Good evening, everyone. We are actually starting right on time for this particular conference. Welcome, everyone. I'm really glad that you're here. And I really don't mean that in the generic conference way. I mean it in the very specific way that applies to a group of professionals and possibly patients, maybe joining us too, who are choosing to spend their evening and these next two evenings after this one talking about sleep instead of actually sleeping. And that already tells me a lot about this room. For those of you who I have not met yet, I am Dr. Donna Coriel. I'm a physician and internist to be exact. I'm the founder of SoMeDocs, and I'm going to be chairing this sleep conference. So I want to start by naming something that we all know, but we don't say out loud enough, and that's that sleep has become one of the most confusing topics in health. On one hand, it's treated like a lifestyle flex, right? We track it, we optimize it, we hack it, we wear three devices and we compare scores like it's a competition. And on the other hand, it's minimized. You're tired? Everyone's tired. You're not sleeping? That's just stress. Welcome to adulthood. And in the middle, all of us are clinicians, many of us here, trying to help patients to make sense of their exhaustion, often struggling with our own exhaustion. Because if we're being honest, this is a room full of people, clinicians who know that sleep matters, but still don't get enough of it. We counsel patients on sleep hygiene while we're answering emails late at night. We recognize exhaustion clinically, but we normalize it culturally. So, this conference is not going to be about perfection. It's not about turning anyone into flawless sleepers. It's going to really be more about understanding sleep as complex, individual, and deeply influenced by things that we don't always talk enough about. And that's things like mental health, hormones, age, culture, performance, pressure, technology, and messaging. And that's why this conference was built the way that it was. Sleep doesn't belong to one specialty. It definitely doesn't live in a silo, and it definitely also doesn't respond to one size fits all advice. And that's why I build these lectures and I bring so many amazing experts, top experts in the medical field to teach us. So, over the next few sessions, you're going to hear from credentialed experts, as SoMeDocs, the company that I founded, promises to deliver. You're going to hear from them. They're going to be looking at sleep from different angles, from psychological angles, pediatric ones, athletic, hormonal, metabolic, data driven, and media aware. And instead of walking you through every speaker right now, you could just look at the landing page. I will say this, each talk is meant to add context and not noise. We're not here to collect hacks. We're here to sharpen how we think about sleep for our patients and maybe for ourselves. And again, we are welcoming both doctors and patients to this conference and every lecture that we're going to be hosting at SoMeDocs from here on. And this all matters because many of us here, those of us that are physicians like me, we were trained at a time when sleep barely showed up in medical education. And now patients walk in with wearables, with apps, podcasts, and very strong opinions about what's wrong with their sleep. And that gap between what patients believe and what physiology supports is where frustration often lives. So, this conference is meant to help us bridge that gap, not by oversimplifying sleep and not by demonizing technology, but helping us to place everything in context. And of course, doing that with sleep experts. If you're here for better tools for your practice, you're in the right place. If you're here because your patients keep asking you questions that you don't feel equipped to answer, you're in the right place. And if you're here because you're tired and you want better answers than just go to bed earlier, then you're also definitely in the right place. Now, one last thing before we start. Give yourself permission to just listen. You don't have to necessarily agree with everything. You don't have to turn every talk into an action plan. Sometimes the most useful takeaways are better questions or the realization that something that we thought was normal maybe isn't. So thank you for being here and for trusting us, for trusting the SoMeDocs brand with your time. I'm really excited to get started. Now let's walk through how the conference is going to run, and then we're going to dive into our first session when it turns 7 p.m. All right, here we go. I am actually going to share the screen so that you can see what I'm looking at. And together I will show you exactly what you need. I have a little um, a little note section that tells me what to cover to make sure I cover everything. Please, while this conference is going on, please feel free to use the chat. In fact, if you can write where you're coming in from, I would really love that. Let us know where you're tuning in from, what city and state you're in. I invite you all as the chair of this conference to use the chat regularly. This is very much like a real in-person conference in the way that it's built, but one of the key differences is that we can actually accomplish so much more. So chatting during a lecture, during when someone speaks, is actually encouraged here, right? We encourage you to chat because the speaker doesn't actually see you chatting, it's virtual chatting. So open up your chat box if you'd like to and use it. Add comments in there, ask questions. We're going to have Q&A sessions at the end of each talk, and I'm going to be the MC for the night, and I'll MC those questions. I'll throw it at the speakers and network. That's a really important part as well. Okay. So this is SoMeDocs. I'm going to show you how the conference works, and that's by taking you to our website. We're at doctorsonsocialmedia.com. And here we have a site that promotes autonomy in medicine. And we're an omnimedia healthcare platform that features the experts of health today. And the way that you reach the lectures and the courses in on our site is that you hover over the word learn in the menu and you click lectures and courses. I'm going to show you how to find this the conference details if you ever lose it. You go to coming up. When we're finished, if you hold a VIP ticket and you want to access all the recordings, you would go to on demand. So coming up is where you go before we're finished, and that's now. And here it is right at the top because it's happening now. But if you ever come here and you want to look for other events and lectures, we have many, many scheduled. You can use the filters on the side to toggle what you need. So in this particular case, you could, for example, choose live online conference and it would weed out the curated conferences so you can sign up for them individually. Let's say you want the menopause conference in March or the ongoing private practice conference or the public speaking conference, and there's many, many more you could do that versus just the individual lectures versus networking sessions, etc. So we're going to go into the Sleep Well conference. That's our conference. This is the landing page. We build a landing page for each curated event. And here you can listen to the promo that we have pieced together with our speakers. And here there's like a little menu that's specific to the conference that you're opening up. So we're going to scroll down here, and this is happening live February 3rd to the 5th. When I scroll down, we see the registration. Of course, as of 2026, we're making our lectures and conferences free while they're live. So please use up everything. We have incredible experts that are joining us. So opportunities to really break barriers in healthcare and not charge thousands of dollars to learn from one another, really learn from one another for reasonable prices. So there's free and then there's a VIP ticket. The VIP ticket you could purchase anytime, and that gives you access to all of the recordings of this conference to watch at your own time and pace. We do have a pre-conference discounted price going on right now. It went up from 129 to 199, but you can use the code sleep well, all caps, sleep well until midnight tonight to get $70 off. So it'll be $129 like it was until now. And then it goes up to 199 when the conference ends. It's up to $249. That's the full price. But again, you have access for 6 full months to learn. Underneath it, you'll see CME options. That's reflectional CME. We work with a third party called CMify. It's a very innovative company. I'm very proud to be working with them. It is co-founded by an anesthesiologist, Dr. Brian Cohen, and you can click here and you can purchase through them. You could read all about it and make sure that it applies, etc. Scrolling down, you'll see the speakers that we have with us for these next 3 days. They have all been selected because they're experts and because their talks were interesting and relevant. What you can do as a user is you could click into any of these speakers and you will get taken to a page that's specific for that talk. So you could read much more about the talk, uh, what the talk is going to deliver. You can meet the speaker and meaning hear what they have to say in a little video. You can read the details about some of the learning objectives. You can also click in and learn about the speaker in their profile. We have a directory on our site that hosts profiles of doctors. We're growing very rapidly because membership is actually free in 2026 for US healthcare professionals. And that's in an effort really to promote physicians to offer up collective PR and marketing for our field because it's missing. So you can, when you open up a speaker's profile, this is all a very unique profile. You can see a lot that's in it. But what I wanted to show you is that you can follow them on social media where they are. Each physician, each speaker is in a different place. You can also jump to an inquiry and you can literally just send them send them an inquiry that lands directly in their inbox without having to pay. So we encourage you to do that if you want to ask a question. Maybe you want to commend them for their talk. That would be fantastic. We're going to collect testimonials at the end of this. Please don't leave without sending us a testimonial. It really helps because we are doing this for free while it's live. So that's each speaker and how you can, send them an inquiry and get in touch. Scrolling down, this is the agenda. So this is literally the schedule where you will find all the lectures when they're taking place. As you see, we already had one lecture delivered back last Monday, and that's over. So that's already in the VIP section for those of you that hold tickets or are watching this after the fact. We also have an additional bonus lecture scheduled out in February 25th, and that's because we couldn't fit all the lecturers and the experts that we wanted to. And so that's going to be a bonus lecture for you. And it's also going to be free while it's live. Otherwise, this is me. I already introduced myself. I am going to be answering questions at the end of tonight. I'm going to be staying for an extra few minutes. If any of you have any questions about SoMeDocs, how to become a member, again, for free, how to get involved, how to increase PR and marketing for yourself, for your career. So important for me to do that. We have swag. So I designed two different shirts that are the official swag of SoMeDocs Sleep. And we are actually doing a giveaway. One of you will win one of these shirts, whatever one you choose and whatever size you want. To enter that giveaway, you have to simply go to social media and let everybody know that you're here and you're soaking up this amazing conference for the next 3 days. And tag us. We're at SoMeDocs so that we can see and we can count it as an entry. And one person is going to win, again, a t-shirt of their choice for free on us. Okay. You can add these lectures to your Google Calendar. So if you click this button, it'll take you to Google. You can add accept, you can press accept, and then all the lectures basically populate your days so that you know that, tonight it's this person speaking and that person speaking at this and that time, etc. The hashtag we use is SoMeDocs Sleep for this conference. It is the first annual conference that we are hosting about sleep. So we are very excited about that. All right. Now, uh, we have two different ways of interacting with attendees and speakers when we're not in our Zoom session. So first of all, if you're in the Zoom session, this is the Zoom link that you're going to be using for every single lecture. Okay? Every single lecture until we end on Thursday night. Networking is going to be the only different link, and that's going to be emailed to you on Thursday. So you're going to be getting, if you're registered, you're going to get an email every day with a reminder about the links for that day, the schedule for that day, and everything all laid out. Wednesday, February 25th's lecture is going to be different as well, but you'll be emailed separately for that as well. So we have two spaces where we can interact and network and ask questions when we're not in the Zoom, and that's one is a Facebook group. So we have our Facebook groups right here. You see in the menu, it says spaces. You go into that and you could see the Facebook groups that we have. SoMeDocs Healthcare is where we'd like to hold those conversations. So if you click in it, request an ad, and we'll add you in today. I did already post a question about sleep on there, and I'm going to post a few more questions as well. We also have a WhatsApp group. So if you did not get the WhatsApp link via email, please be sure to check that email or ask me in the chat, and I'll be happy to forward you that link. Again, if you're here, please let us know where you're from in the chat. We want to make this interactive and fun. Here is that Facebook group. It's called SoMeDocs Healthcare. It's open to not only healthcare professionals, but the public as well. We do have other groups. This one is for doctors only, the SoMeDocs Facebook group, and this one is for all healthcare professionals only, MedSide Ventures. But this one is for everybody, so we can talk about sleep openly and not worry about anything. Okay, the next thing I wanted to talk about, VIP tickets we spoke about, the giveaway we spoke about. Okay, so with the giveaway, like I said, one of you is going to win a t-shirt, and that's in partnership with Give Them Swag, which is the site that we run with all kinds of swag that has to do with healthcare and fun conversations, important conversations. So, do you guys, let me just see the time. If you are listening to this and you're active on social media, you probably see all those posts about the conferences that are happening in real life where everyone is like so excited to be there and it's so amazing. And you sort of almost feel that FOMO, that fear of missing out emotion that, oh my gosh, I'm not there. Well, SoMeDocs is here to break boundaries and to make things different and to change things up and to say you don't have to pay a fortune to learn health and to learn healthcare. You can literally learn all kinds of healthcare issues and health topics for free and for a reasonable price. And that's what we'd like to do. And so we really, really encourage you and invite you to post about this so that the whole country and the whole world learns that there is a place where experts are being brought together to share the knowledge that we all need to soak up and that we're doing it at a reasonable price and for free, etc. Okay. Last but not least, I mentioned this before. I'm going to be staying after our conference is over, or after tonight's session is over at 9 Eastern. And I'm going to be answering any questions about this conference and about SoMeDocs in general. We do have a few minutes left. We have about 10 minutes before our first speaker. So I'm going to take this opportunity to very quickly just let you know that becoming a member, as I said, for healthcare professionals in the US is free. So you click into become a member and you choose healthcare professional. We do have students that can join as well. You click into healthcare professional and you choose the profile option, which again is free. You can look at our Beyond also membership, which gives you a lot more. a lot more perks, really great perks. And then you can also take a look at our PR and content package, which is a really unique way to get visibility online and to get going on a more personalized basis with someone that knows how to build. So that's really, really exciting for us. Again, I have a few minutes left, so I will show you the directories that we have built. Our original directory was the doctor directory. That's for mainly for physicians. We do have some podiatrists and dentists in there, but we will eventually be separating everybody out. We've recently built new directories for allied professionals that are working in healthcare with us because healthcare is a team sport. We have dietitians, nurses, therapists, pharmacists, and scholars. That's PhDs and masters. And again, we have a directory for students and even a directory for experts for doctors, for those that have services for us that can help us to become more autonomous and practice more confidently. We also have directories that are called side ventures, and those directories list health experts and experts in general, their podcasts or YouTube channels. We have books and blogs that are all laid out in directories that you can look through and use filters for. We've got a speaker directory if you're hosting an event or are advising an event and looking for specific speakers. We have courses that are other people's courses and not just ours. We have coaches and consultants, and then we have a communities directory. So we have all these directories, and the goal is to just build a site that really neatly categorizes healthcare and makes it easier for the world not to feel like they're drowning when they're online and they're really looking for experts that they can follow. This all organizes us, it categorizes us like a library, and it makes it really exciting to be able to find the real experts in health. So I'm going to open the doctor directory. Again, I have about 6 minutes left and just show you all of the different doctors that are here that you can learn from. And you can certainly use the filters on the side to filter your search. We have been used by big outlets. We've been used by the Wall Street Journal, by Medscape, by HuffPost, by Men's Health, by different startups that are looking for advisors and new positions for their ventures. We've had podcasters looking for guests. We've had other media sites look for quotes. And the way that they do that is that they sometimes use the filter. So they go in and they say, well, I would like someone from pediatrics because I'm writing about something pediatric related. And I want someone maybe that's got you got video presence because I'd like to link that. So I'm going to do that. And maybe I want someone also in private practice. So these are the pediatricians who are in private practice and are also present on YouTube. That's filtered down. And then you can open any of these four to look through their profile and in his case, a portfolio because he's given a talk for us before. And you can decide if you want to send him an inquiry for your project. So this is a really great way to promote networking. I will say that the networking session is my favorite part of these conferences, and it's extremely productive. So I urge